This is the Bartkowski Associates Research Team, the firm that evaluates Mississippi SPF Rx. SPF Rx is Mississippi's Strategic Prevention Framework Prescription Drug Project. SPF Rx is a 5-year drug prevention grant funded by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. This video summarizes SPF Rx accomplishments for project years 1 through 3. The Mississippi SPF Rx team trained Mississippians facing elevated risk as a result of the opioid epidemic in 5 primary counties, those counties being DeSoto, Harrison, Hinds, Jackson, and Tishomingo. Other Mississippi counties have also been served. Using current data from the county health rankings in the U.S. Census, we compare our priority counties to Mississippi at large and the top-performing U.S. counties. Mississippi exhibits the greatest mental health strains of any state. Mississippi is also among the states with the highest prevalence of alcohol and substance use among young adults. They are also at great risk when compared to the highest-performing U.S. counties. The highest risks include premature death rate, poor or fair physical health, poor mental health days, percentage of alcohol-impaired driving deaths, sparse mental health providers, and limited social associations. Mississippi SPF Rx is organized around one overarching goal: to increase the awareness of prescription drug misuse and related risk behaviors of overprescribing and sharing of prescription medications. So what impact has SPF Rx had on prescribers and pharmacists at training events? Fortunately, the results have turned the tide in overprescribing awareness. Mississippi SPF Rx has innovatively hosted trainings on 10 individual topics related to healthcare providers' roles in opioid overdose prevention. 115 SPF Rx trainings have been implemented since July 2022. As of April 1, 2024, Mississippi SPF Rx has trained approximately 1,700 healthcare providers. Nearly 50% of trainees have practiced for more than 15 years. Of those, 1,395 have been prescribers or pharmacists. Additionally, about 70% of trainees were white and 20% identified as Black or African American. The gender ratio was nearly split, with 50% identifying as male and 49% identifying as female. During trainings, participants were encouraged to bring their own professional experiences to training discussions. This approach was designed to enhance their knowledge and application of substance use prevention skills. The evaluation team utilized a post-only training survey to gather responses from participants directly after the completion of each event. The feedback from training participants has been overwhelmingly positive, especially within the 3 following categories. Nearly 92% of the total participants learned new information or skills from the SPF Rx trainings they attended. 3/4 of all participants were likely to use the new training information or skills in their daily profession. 98% of participants felt confident in using the new training content or skills. Nearly 3/4 of participants felt very confident in their ability to apply what they learned. These compelling results showed high levels of effectiveness in SPF Rx substance use prevention trainings conducted in Mississippi. As a significant aspect of SPF Rx activity implementation, the SPF Rx team conducted the healthcare provider surveys between September and November 2022. The substantive items reflect the knowledge participants would receive in SPF Rx trainings. However, during this time, only a few SPF Rx trainings had taken place with only a small number of healthcare provider participants. For this evaluation activity, we created 2 surveys. One survey was for the general provider audience. The near-identical surveys gathered insights into opioid-related training preferences and professional experiences. The survey subtopics included professional experiences with opioid prescribing. Communities within which medical surveys were provided were also addressed. All responses were disconnected from identifying the participant before the analysis of the survey results was conducted. The healthcare provider survey collected 392 submitted surveys from general providers in Mississippi. In this video, we refer to the general provider sample as prescriber. The healthcare provider pharmacist survey collected 109 submitted surveys from Mississippi pharmacists. At the beginning of this survey, we collected demographic responses, showing that nearly 60% of prescribers were licensed practitioners of more than 15 years. Approximately 40% of pharmacists also had more than 15 years of experience as licensed practitioners. The majority of healthcare provider respondents identified as white at 321 prescribers and 92 pharmacists. Prescribers were also 10% Black or African American and 3% Asian or Asian American. Pharmacists were 7% Black or African American and 4% Asian. Approximately 5% of prescribers and 6% of pharmacists preferred not to specify. Similarly, 60% of pharmacists and 57% of prescribers identified as female. Approximately 40% of each provider sample identified as male. In these graphs, we can see a range of familiarity with various substance-related topics among prescribers and pharmacists. In the top left graph, 69% of pharmacists and 75% of prescribers were very familiar with with the risks of opioid misuse. In the top right graph, most of the pharmacists and prescribers were only somewhat familiar with counterfeit pills. In the bottom left graph, an even split of pharmacists were somewhat familiar and somewhat unfamiliar with prescriber report cards. Interestingly, 36% of prescribers were only somewhat familiar with prescriber report cards. In the bottom right graph, a large majority of pharmacists were very or somewhat familiar with Mississippi's naloxone standing order. Alternatively, 17% of prescribers were very familiar and 35% were somewhat familiar. Finally, when asked about the guidelines associated with opioid misuse risk assessment and naloxone dispensing, 1/3 of pharmacists and more than half of prescribers were not familiar with either CDC or SAMHSA guidelines. As mentioned earlier, the data collection took place during the start of SPF Rx training implementation. This is so training content related to knowledge and skills of opioid misuse prevention could be increased by SPF Rx training participation, and this potential change could be reflected in a second wave of this survey. Through the 5-year project timeline, Mississippi SPF Rx has been very successful. Points of achievement include high numbers of healthcare workers, namely prescribers and pharmacists, who have been trained in substance use prevention. The project's impact is expected to accelerate in its remaining 2 years. SPF Rx is part of a larger group of opioid-related grants implemented in Mississippi. Together, these projects are expected to significantly enhance the state's response to the opioid epidemic.